Hi, welcome to the section of cardiology. This is Dr. Jaitly. In this video vignette, very briefly, I want to discuss something interesting that you may find, and that is always a question: is coffee good or bad for health? Well, it's a very broad question, but then specifically or in generic way, I could mention that number one, in excess, anything is bad, so including coffee. I mean, if you overdo it, like beyond 6 cups a day, you could have deleterious effects. But the very fact that it has certain antioxidants, it has a theophylline-like component, it has a stimulant effect, and it has a diuretic effect. All those effects could be helpful in a way, and very facilitatory in terms of either prevention of the disease or progression of the disease, etc., or getting the symptoms better controlled. So let's take some of the conditions that I've listed here one by one. In Parkinson's disease, it seems to have some beneficial effects in that the person is a little more cognitive in his or her function. Liver disease specifically, there is a reduction in the fatty liver based on imaging. The cirrhosis is delayed or can be prevented because it prevents liver fibrosis. The compounds in the coffee, they can prevent liver fibrosis, and that's an antioxidant effect, if you will. There have been some reports where there have been reductions in the incidence of hepatic cancers in coffee drinkers. Very interesting medical data. It definitely reduces the risk in diabetes type 2, unless and until it's obviously coming in with lots of sugary stuff with coffee in your diet, then that's a different issue. But just plain coffee alone reduces the risk of diabetes in many patients. Clinical depression is definitely treated well with coffee. In fact, it's a very good stimulant early in the morning, a cup of coffee or two. It gives you the endorphins, raises your heart rate a bit, your blood pressure, and your cognitive function, and it becomes a very stimulant and gives you a positive effect because of, again, antioxidant effects within the coffee compounds. There have been reports where heart attacks there have been some incidents of lowering of incidence of heart attacks. In fact, the compounds listed here, again, these are all tongue twisters, but gamma tocopherol and caffeine per se, and then coumaric acid and scopolamine. These are compounds where one can say that they have antioxidant effects, and therefore the coronaries here, as I've shown on the left panel, they tend to have better circulation, and the chances of somebody having a heart attack is lessened. Not that it's totally nullified, but it's definitely lessened with 1 or 2 cups of coffee a day. And likewise for heart failure, where the muscle is weak, as I've shown here, the heart rate, the blood pressure, the cardiac output, and the diuretic effects. That means more urination in that person. And as we know, the heart rate and blood pressure and the cardiac output, they are very interdependent parameters. So that helps in heart failure settings. Coffee is also helpful in bronchial asthma because it has a theophylline component. And remember, tea, coffee, they all have a theophylline-like compound. In fact, we have theophylline tablets for bronchial asthma. So here you have a built-in theophylline within the coffee. So in fact, I remember the years when in the emergency room, as soon as the bronchial asthmatic patient arrived, one of the first things that you do is, of course, besides giving oxygen and giving bronchodilators and inhalers, and once you have this treatment going, the person starts to improve, and he or she can be given a hot cup of coffee to slowly sip, so that gives you an additional theophylline bronchial dilator effect, if you will. And again, avoid coffee if you want not to disturb your sleep patterns, unless you're working at night, but then your diurnal variation is different anyway. And again, it's very good for long distance driving. I always use that as a great beverage to keep yourself nice and awake at the wheel. So, but just a word of caution, the contents are always very hot, so just be very careful. So here on this right side of the panel, as I've shown, lungs, bronchial asthma is certainly improved. You have a cognitive improvement of depression here, as well as Parkinson's disease. Hepatic fibrosis here, as I've shown in the right panel, in the liver, which is sitting in the right upper quadrant region. The fibrosis is lessened, fatty liver is lessened, and cirrhosis is lessened. And in the kidneys, there is a diuretic effect. That means more volume of urine and sodium can come out. So the heart failure patients can get better as well. And here's the pancreas, which is a triangular organ sitting right behind the stomach and next to the liver, posteriorly. And that certainly is producing insulin. So type 2 diabetes patients can have a better insulin production in these patients, as shown by caffeine. Okay, I hope you found all of this interesting. Thank you so much for your interest, and more later.